Welcome back to another episode of Root Cause Solutions for You. My name is Fabiola and I am your host. Today I'm super happy to have a very dear friend of mine and also someone who I've had the pleasure and privilege to work side by side, Dr. Leslie Pasco. She is a dentist with over 26 years of experience. Today she's going to be talking to us about Myo Way Centers for Kids and shedding some light into improper jaw growth and development. So thank you so much, Dr. Leslie, for being here with us today.
Oh, thank you, Fabiola. It's really great to connect with you and be here with you today.
Yeah, thank you so much. Tell us a little bit about yourself.
Oh, sure. So dentistry for 26 years, in and out. I did wet finger dentist for 50% of my career, and the other 50% was focused on practice management and helping dentists grow their practices and be able to provide excellent care and service to their patients. During my time as a clinical dentist doing the actual dentistry, I noticed a lot of things happening with the way kids were developing and growing, and it really gained my interest. And over the last 10 years of my career, I've spent a quite decent amount of time researching that and finding out what's going on and why it's happening and what we're supposed to do about it.
Yeah,
Personally, I'm married. I have a daughter. She's 12. I like to cook and I love to read, and I'm addicted to learning new things. So,
that's awesome. Yeah, so what led you into the Maya way route? Because having worked with you for a few years and with when we were running the practice together, we did a lot of dentistry. We helped a lot of people that way. But what led you to be still within the field, but a little bit different?
yeah, after 26 years of dentistry, I got to a point where I felt like I contributed everything that I could to the dentistry profession as far as fixing teeth and gums and that sort of thing. And so the more I looked into this issue with improper jaw growth and development and the effects that it has on children, but also those effects that transition and follow a child into adulthood, I realized that a lot of our healthcare or our health issues and healthcare costs are really centered around the fact that we're not breathing right because our jaws didn't grow right. And I found it really interesting that if you go back in time a couple thousand years when we had to hunt and gather our own food and live naturally in outdoor types of environments, and we ate our food more raw in nature than when it wasn't processed and all these chemicals and things, human beings actually developed the way God intended them to develop. Our blueprint is right. We're messing around with it and we're adapting. And I found it fascinating and thought we could get in and develop kids properly from an early age, how could that affect their health long term? And I started looking into different ways to do that. And then I attended a 10-day summit from an inventor of an appliance that helps myofunctional therapy, the training the muscles of the face and the head and neck, accelerated training of that. And he said over and over again during the summit, if we could just get these kids when they're 5 years old, and I said, oh, that's what I'm thinking. And he's saying it. And I'm like, then why don't I just do that? So I sold my dental practice and I opened up a center that is just strictly 100% focused on the growth and of the jaw structure, the muscle structures of children.
Wow, that's awesome. Because from a nutrition perspective, we've definitely seen how the body is so intelligent. The body knows what to do, it knows how to heal and repair itself. So to the fact that it has modified its physiology to keep up with the different stressors that we've come across, right? All the chemicals, the fluoride, right, that we're exposed to from our dental products and the water and all the processed food, just like you were mentioning. And so it's a testament as to how our blueprint, like you said, it's perfect. It's just us who tend to then do something to it, or the environmental as well that causes that the adaptation. And I don't know if you might be familiar with this book from Dr. Weston A. Price.
Yeah.
Uh, yep, you got it
Yeah.
right there.
Very
That's right.
nice.
That's right. That's right. Yeah. And it's so amazing. And sometimes when I was talking to a client, she's 19, and we're talking about wisdom teeth and stuff like that. She's gone through some dental stuff and she had no concept that our jaws were bigger. And then now we've had to come up with solutions because now our jaws are not as big as they used to accommodate all our teeth, right? Um, so what are some of the ramifications? What are some of the symptoms that could arise from not developing the way that we should be?
Yeah, absolutely. So, a few things to point out, Fabiola. You actually said it, wisdom teeth, the impaction of wisdom teeth. If we go back 10,000 years and we were living with impacted wisdom teeth, I think the human race would have died. We wouldn't have made it. Infections and septic situations, there's no way. But the jaw growing smaller creates a smaller environment for the teeth, including the wisdom teeth and all the teeth that we're supposed to have. So we're seeing children developing with it's part of the evolution process, so to speak. But is it evolution is my question. I don't know. We're seeing children develop with less wisdom teeth, if any at all. We're seeing children with other missing teeth in the front part of their mouths or congenitally missing from birth. They were never born with them. The buds for some of their adult permanent teeth. So that's one thing. But when the oral environment is too small because the jaws are growing too small, then we don't have room for our tongue. And when we don't have room for our tongue, the nasal cavity doesn't develop right either. And so then we have breathing issues. And so we're seeing a rise of CPAP machines in adults and geez, even in children, and they develop CPAP machines for babies too, which is really scary. We're seeing this rise, and it's all because our jaws are developing right. These types of problems didn't exist before. But if we're not breathing right, Fabiola, then we're not feeling right either. And I think as adults, we have a hard time dealing with that. If we're not breathing right, we're not feeling right, we're cranky, and we're not breathing right, especially while we're sleeping and we're not getting a good night's rest, and our body isn't resting and digesting and healing itself the way that it should, then we get grumpy. But then how does a kid relate to that? They don't understand that either. If we can barely control it, how is a 5-year-old going to control it? So the signs and symptoms that we see a lot are similar to the signs and symptoms of ADHD: irritability, hyperactivity, sleepiness during the day, not paying attention, inability to focus, poor behavior, lashing out, bullying, being bullied. We see this. And I'm not saying that every diagnosis of ADHD is incorrect, but it makes me wonder how many are. And could a child's behavior and health be improved by getting them to breathe better? And it
Yeah,
starts with developing the airway.
that's totally true because that lack of oxygen, there's a reason our bodies cannot survive without oxygen, right? The brain, I can't remember how many minutes, but that's how important it is. So if you're a mouth breather, you're not sleeping well, there's that lymphatic system that it is your brain's own lymphatic system that it only activates at night. So that cleanup crew can never really come in and clean up. And the tossing and turning, I'm sure that would that be a sign of improper breathing and something going on?
Yeah, we actually call it the messy bed. When you see the tossing and turning, when you hear the snoring, and here's something that I felt duped with in the dental profession: teeth grinding. Teeth grinding in children and adults is actually trying to open up the airway and get the muscles to do what they're supposed to do so you can get more air. In dental school, we were told, oh, it's a natural part of growing. But later, in my research and my study and seeing what's going on, it's really trying to establish and grow the airway. So, yeah, you're absolutely right.
Yeah. And I wonder too, are we then, when we are tossing and turning, snoring, mouth breathing, and not getting that proper oxygen, are we really truly in a parasympathetic nervous system engagement, or are we really more on a kind of half and half, more sympathetic nervous system? And then you could get quote unquote your 8 hours of sleep and then still wake up and not feel refreshed, right? No, that
Right.
tight.
Yeah, that's exactly right, because your body's pushing out the epinephrine to save you from the saber-toothed tiger that you're trying to run from. It's our programming, it's our blueprint, and that's all good to have if you're being chased by a saber-toothed tiger. But if you're not, and your body thinks it is because you're breathing through your mouth, which is the only time you're supposed to breathe through your mouth, when it's a quick response to save your life, basically. Because breathing through the mouth, the misconception is that you're taking in more oxygen, but actually you're taking in 50% less oxygen. by breathing through your mouth because the mouth is a big hole, the nasal cavity is a small hole, and the air resistance going through the nose actually increases the amount of oxygen intake. Yeah, and also breathing out through the mouth. So there's this concept that we breathe in through the nose, breathe out through the mouth. Actually, that's not correct either. You should be breathing in through the nose and breathing out through the nose. And the reason why you want to do that is because you want to build up your CO2 tolerance because the CO2 is what creates the oxygen release from the blood cells. So if you can tolerate CO2 in your body for a longer period of time, that CO2 then actually stimulates the hemoglobin in the red blood cells to release the oxygen. So you're out getting the CO2 out of your body should actually be a slow exhale process through your nose. Your exhale should actually be longer than your inhale. But most people think I got to inhale longer to take in more oxygen. But you can take in more oxygen, but if you can't use it, then there's no point in it. So be efficient in using your oxygen and breathe slowly out of your nose.
That's a great point. And so you mentioned the tongue. I always think of the tongue has its own brain. It moves around. And when I had braces, we just travel around and inspection things. And I always think of it as a duck's tail. Um, and it is so funny to watch people when you talk about teeth or anything, how their tongue starts inspection. You probably noticed that, but I think it's hilarious how that tongue behaves. But where should the tongue be when we are breathing? Because I think that's also something that because maybe the structure of the jaw is not like you said, there's not enough room for it.
That's correct. The tongue should be at the roof of the mouth behind the front teeth. So the tip of the tongue should not be on the front teeth, but slightly behind it. And ideally, the entire tongue fills the roof of the mouth. And so if you do that properly, the tongue is the natural expander. So kids go through orthodontic therapy to get their palates expanded. But if the tongue is sitting in the right spot, the tongue will actually expand the palate, which is the floor of the nasal cavity, naturally. But because we live with dogs and cats and we have a diet that isn't crunchy or chewy, we go straight sometimes from being born to the bottle or from the breast to baby food. In indigenous tribes, there is no baby food. They just, after 4 months, they just start chewing. You know? And so they get the exercise and their tongues are strong. And so they naturally go in the right spot. So the tongue should be at the roof of the mouth behind the front teeth to develop the floor of the nasal cavity. But in a mouth breather, the tongue drops to the floor of the mouth behind the lower front teeth. And then that creates more force from the cheek or the buccinator muscles. And those buccinator muscles are very strong as well. And they actually squeeze the face in, and then you get this compressed palate. The palate isn't expanding and it's being compressed in. So now the palate, which is the floor of the mouth, is high and vaulted and it's taking up too much space in the nose.
Wow. Yeah. I was at a virtual conference about a month ago. And one of the things he mentioned is that when you look at all pictures of the tongue and physiology, it's always at the bottom. It's never placed correctly. So we're even from educational perspective, given the wrong visual as to where the tongue should be at.
Yeah,
Yeah.
exactly. Yeah, I was doing some research on some nasal breathing pictures, like just a graphic of how you breathing pictures, like how you're supposed to breathe. And a lot of the pictures actually showed the airway going through the nose and the mouth. And yeah, and I think we just become so accustomed to it. And we're not looking back in the past to actually see what our ancestors did that helped them have better health than we do today,
Yeah.
really. And breathing through the nose is one of them. It's a controversial book. I think it's called Shut Your Mouth and Save Your Life. It was a gentleman who did research in the early 1800s. He studied Native American Indians and noticed just their beautiful facial symmetry, their improved health, their strength and stamina. And they actually, Native American Indians then that he researched, frowned upon anyone who would open their mouth and breathe. They knew it wasn't healthy. And in fact, Native American mothers would actually close their babies' lips when they were sleeping to keep training them to make sure that they were breathing right through their nose.
Yeah, like I'm sure that as kids, as we grow and proper training of those muscles of really the body, like I said, it's very intelligent. So when you really teach it properly, it will do what we're asking it to do. But I just felt like kids would not wet the bed.
Yeah. That's a symptom as well. And that's from the fight or flight response from smooth muscle relaxation and the inability to tolerate the CO2. So the smooth muscle relaxes, which is like the bladder, and then the kids wet the bed. Now, in early ages when they're still learning how to control, that's a different situation. 5, 6, 7, it shouldn't be happening. And so, yes, that's one of the symptoms as well. Absolutely.
Yeah.
Yeah.
Yeah. That's intense. And those breathing through your mouth, could that also impact pH level and then lead to dental? Because some people are like, I have the perfect diet. And some people do try really hard, right? They eat organic, they don't eat processed. They floss, they buy good products. And sometimes the dental checkups are like, you have some decay. Is that because we're breathing through our mouth?
Yes, a lot of the times it is. There is a strong correlation between decay and mouth breathing because saliva is supposed to help keep your mouth clean, among other functions. But if you're breathing through your mouth, it dries up the saliva. And so you get chapped lips from breathing through the mouth. You get dried gums, which then you get a bacteria infestation. And then the saliva can't wash or clean the teeth like it's supposed to. So it actually creates an acidic environment and decay sets in. And we'll usually see in mouth breathing children, one of the signs and symptoms is also decay on the front teeth. So it could be from having a bottle in their mouth too long. And that's what, as a dental professional, I was trained to understand. But no one ever told me, oh, if the child has decay in their front teeth, it's either because they're sipping on juice too long, they're eating too much sugar, they're in the bottle too long. It could be because they're breathing through their mouth. But
Yeah.
now I graduated dental school quite a long time ago, because almost a few years ago now. I hope they're bringing this back into school. I'm trying to get in touch with the school, and we have to teach these young dentists that this is what they need to look for. Yeah.
Yeah, yeah, that's for sure. And even I'm sure like build up around front teeth, I think that's very common
Hmm.
where other areas might be better, but then those front teeth behind where there's just a lot of that film that is just now hardening because yeah, our teeth are not cleaning themselves.
Yeah, that's right. That's right.
Yeah.
Yeah,
So
absolutely. And the tongue
uh,
position is important when you swallow too. So, is the individual thrusting their tongue forward? Where is it going? And that can create dental problems, that could create facial asymmetries, and it can weaken the tongue as well. Paying attention to all those things. There's so many things to pay attention to. But Fabiola, you pointed out, which I thought was a really a genius observation, is we just got to, body knows what to do, right? And if we do what we're supposed to do, which is really hard to do, but if we do what we're supposed to do, it should work. But in the muscle, the tongue, it's a muscle. And just like our abdomen, our abdominal muscles, if we strengthen those, it helps our posture. We sit up straighter, it opens up our diaphragm, we're in better condition. If we work out our biceps, with our biceps get stronger and bigger. It's the same thing with our airway muscles, because that's all our airway is muscle, no bone, and our jaw muscles too. So if we exercise those on a regular basis, they get stronger and they function better too.
that's awesome. What about obviously, like you said, this is like getting the kids, right? Catching as they start to develop because when we're born, our skulls are super soft, right? Our body has a schedule in which it develops different things. But like you said, that carries into adulthood. So all these people who are now like suffering of, I even think of asthma. Like I even think of the snoring.
Yeah, it helps if you exercise those airway muscles and you make them strong, and it can pull open the airway, and it can actually, your jaw muscles, if they're strong enough, will actually help you bring your jaw forward naturally. It opens up the airway and you have less or no snoring. Now, there's other conditions that are associated, obesity and too much alcohol. That stuff's all going to play a part. But yeah, you brought up about asthma, and that's a good point. There's a book here that I did a lot of training with, and I'm working on getting certified as a breathing instructor. It's called The Oxygen Advantage, and it was written by Patrick Cowan. Actually, he suffered from asthma as a child, and then he actually learned breathing techniques, and he got rid of his asthma.
Wow.
Being able to breathe properly, and since then he expanded his jaws, opened up his airway, all this stuff. But yeah, you have to look it up. I think you would find it really interesting. He's from Ireland. And I heard him speak, and then I started really studying what he teaches. And he teaches the buteyko breathing method, and it works.
That's
So,
awesome.
mhm.
Yeah. And orthodontic, when I growing up, I've gone, so I've worn braces twice when I was a kid and then as an adult. And I think moving teeth is quite an art. Obviously, people graduate from that school and then you still go through extra schooling, right, to understand all of that. But how do, and it's just almost some point I feel people are like, oh, I'm gonna have to do ortho because my teeth are overcrowded or there's just a lot of gaps there. And then you get sometimes teeth removed to even move to be able to create more space. So how does the ortho treatment impact the jaw, and then how does the myotherapy and techniques can help correct that?
Sure.
Yeah.
Yeah, that's a really good question. First of all, you mentioned that there is the philosophy of extracting the teeth to make more space, so to speak, to scrunch the teeth all together into place and make them look straight. And that's in my opinion, a very old technique. I don't love that idea because the jaw being too small makes the teeth crowded, which is a sign that this person has airway issues. So let's work on growing the jaw first. So any parent should be looking for the type of orthodontist that is focused on not just straightening the teeth, but growing the face. So early intervention, early orthodontic treatment, as early as the age of 6 or 7, can take place where orthodontists will use expanders to expand the upper jaw and create that nasal cavity that we need. But sometimes the lower jaw needs help too. And then if we don't do it right, you got TMJ issues and so on and so forth. So looking for someone who's actually focused on growth and not just straightening the teeth is really important. And during the orthodontic therapy, an orthodontist who is focused on growth understands that myofunctional therapy is essential to the outcome of their treatment because it's the muscles of the face that create the relapse in orthodontics. So the reason why you needed braces as an adult is because the muscles were never trained. If the muscles are trained and doing what they're supposed to do, the results that the orthodontist gave you would have stayed. So that's why people go through braces more than once. And God bless them. Hey, I didn't wear my retainer. Thanks for being honest, but really it doesn't matter. If the muscles aren't going to work, then whether you wear your retainer or not, there's going to be issues. So that's how that comes into play. So it's nice to have a beautiful smile. I encourage any parents when they're looking into orthodontics for their children to really consider a myofunctional or an orofacial type of orthodontist, someone who's in tune with that. And we do work with orthodontists at the center. And again, not every orthodontist believes in that. Some orthodontists still go by the same technique of removing teeth, and I've seen it. And unfortunately, it's sad. Yeah.
Yeah, but hopefully we're changing times. I do think that over the last couple of years, there's definitely been a lot more emphasis, I've seen more hygienists, I've seen definitely more doctors, more dentists who are more advocating for proper function versus just, yeah, aesthetics, right? Because like you said, everyone likes to have the beautiful Hollywood smile, right? And that's interesting. Those are become our standards, right? Actresses or models and stuff like that.
Yeah. Yeah. I think as a society, hopefully because of these lessons that we're learning, we're waking up a bit and we're starting to pay attention. And I think, as you pointed out, and what you do with your profession is helping the body do what it's supposed to do naturally. And if we just don't interfere so much and we follow the blueprint that's intended for us, we can be a lot healthier.
Yeah. Yeah. That's awesome. If so, you mainly work with kids, but you also get adults in your practice once in a while.
Yeah. Yeah. It's natural when the kids come in, we see them and we talk about everything and we enlighten and share the information. And by the end of the discussion, the parents always like, can I do this for myself? And it's always for me a very hard situation to be in because my goal and my purpose is to prevent these problems so that these children can grow right, breathe, and live the best life that they can. And for the adults, we do have what's called a helper program. So they can actually use an exerciser along with their child to help strengthen the jaw muscles. So it will help them, but we don't do any orthodontic treatments or expansions or anything like that. There are dentists and orthodontists who do that for adults. And
Right.
if someone is having some major breathing issues and dental issues, I do encourage a person to look for a dentist that works that way. And we work with and refer to dentists who do that as well for the adults.
That's awesome. Yeah, I
Yeah.
know, right? Walk us through your program a little bit because we talked about the physiology of things and the behind the purpose, the science behind this the therapy. But what's your program like? Someone comes into your office, obviously you're doing evaluation, but what does it entail?
Sure. First, all of our programs have a wide open door policy. We put a time limit on it or an expected time frame of 6 to 12 months of treatment, but we're there every step of the way. If it takes longer, we're okay with that too. Most of our programs are going to go anywhere from 6 to 12 months. Right now, we have 4 programs, one for infants, which goes from birth until 18 months or so. Then we have a second program for toddlers, which goes from about 24 months until 3 years old. And then at 3 years old, we have the preschool program. And the preschool program is until they're about 5 years old or so. And then 5 and up is our school age program. Now, if a child starts early enough, say at birth, it's very possible that they probably won't need the toddler or the any of the other programs. If they start as a toddler, they might not ever see the school age or school or preschool program. We encourage early starts. The majority of the face is of a child is doing its most development and mostly grown by the age of 6. So we really like to get kids in at the 5 year mark because we understand this is a new type of therapy, even though it's been around for a while, but how we're doing it is new. So if we can get them in and we can get them in at 5, then we estimate about 12 months with multiple appliances that we use that are soft and comfortable, medical grade, FDA approved to help the child's face grow properly. Along the way, we have multiple visits with a myofunctional therapist. So that's someone who's just specialized in myofunctional therapy, so training of the head and neck muscles. And then we also have fun exercise programs. So we have a big exercise room that's just adorable. And the kids can come in there and we do that for every age group except infants. And they can actually learn their breathing exercises in the exercise room with their appliances in. And so we teach them how to breathe right. We'll teach them better posture. We'll teach them how to focus better by breathing properly. So there's lots of different activities that are part of that. And the parents can bring their kids to as many or as little activities as they choose. But we encourage at least 3 activity sessions a month. So
Wow, that's pretty cool. And yeah, it's fun, right? When you're like making it fun for kids, because sometimes like kids, we, if as adults, sometimes our attention span is not as long as it could be. Sometimes kids, they're playing with something, they lose interest,
yeah.
right? And they're like on to the next thing. They're conquerors. They just like to move on from one thing to the other. Us adults, I don't know, we've developed I guess as we grow, right? Also, but it could be because we're not breathing right, right? Our attention span is not right.
I think so. Yeah, breathing properly can actually increase your focus. It can increase your sports performance. We're seeing athletes training with taping their mouth shut because they understand that they can have better oxygen exchange and better muscle recovery if they are breathing through their nose and not their mouth. So yeah, our attention spans might be related definitely to whether we're breathing properly or not. But that's why
Yeah.
when we do the exercises with the kids, they're there for a maximum of 20 minutes. It's not too long. We can get the breathing exercises in a short period of time. And they can also do those exercises at home. We instruct them how to do it at home too.
And I think it's commitment. One of the things that I tell my clients, success on your program depends on two things. One, that you're willing to follow our recommendations as closely as possible. And two, that you stay with the program long enough in order to achieve maximum correction of their underlying causal symptoms. It's like going to the gym, right?
Mhm.
One push up, you're not get here to where you would need to. One squat will not. You might be sore because you probably haven't worked out in a while, but it's not getting you to. So commitment. And I think we live in a very fast society where we are at the drive-thru for 5 minutes and we're already honking because who ordered what? Why am I sitting here in my car? Or Amazon Prime, right? You haven't gotten your order in 2 days. You're contacting customer service. But I just think that I love the exercises. I love the treatment room where people can come in and do what they need to do and make it fun because it's that commitment. And parents as well, right? We want kids to be happier and healthier. Then there's a lot of work that goes behind it.
Yeah, that's what's great about our program too, because our program uses specifically designed myofunctional therapy, medical grade appliances that actually fast track that the whole thing. What might have taken years is now taking 6 to 12 months through these appliances that we're using through MRC, Myofunctional Research Center, developed by a dentist actually in Australia. So when we use those appliances, the child only has to have the appliance in for 1 hour a day and at night when they're sleeping. And they might not be able to keep it in all night at the beginning while they're sleeping, but the more disciplined and committed they are to their daytime use, the longer we see it staying in overnight. And when they get to a point where the appliance stays in overnight, we know they're ready for the next step. So then we start doing the exercises and we start, and the exercises are done with an exercise appliance as well. So it sounds, oh, it can't be that hard. Press something with your tongue or do this. I'll tell you what, Fabiola, when you're done doing it, and that exercise is only 2 minutes twice a day. But it feels like that one squat that you haven't done in 10 years. It's sore. It's sore. And the nice thing is when the adults do it with their children through the helper program and they have the exerciser, it tones all of the lower part of the jaw. So you get in all these little lines in between your nose and your mouth. It gives you a little bit of a facelift, which is a nice bonus. Nobody ever says no to that.
That's right. Right. Better than Botox.
Yeah, that's right. Natural Botox.
That's right. That's awesome. So, how does one go about finding your purpose?
Yeah, if they go online, they can just look us up under myowaycenters.com and everything they need to know is right there. There's a history about the center, a history about myself and my husband, who's a partner in it, and our therapist and our team. There's a list of events that we have routinely to educate the public. We really want to help the community understand what's going on, not just with this, but anything else like nutrition, chiropractic care, what is craniosacral therapy, child behavior. So we'll have people coming in routinely once every month or every other month to help the public understand and educate themselves on to how they can be healthier. So that's all on there. Our phone number's on there. Yeah, that's the best way to reach out.
Oh, that's awesome. I love how you're incorporating all different modalities that are safe and natural. And so because I believe in a comprehensive approach. I don't believe one single thing is gonna address that specific thing. It does take a village, right, to raise
That's
children.
right.
And I love your approach of like chiropractic, cranial sacral, and I think that you make their job easier, and then they make your job easier as well because that treatment takes, right? It's like the body's okay. I'm getting help from all different sources.
Yeah, you're right. It's healing multiple areas at the same time. If we can help increase their breathing, through establishing their airway, but their muscles are remaining in a poor posture state, that's going to have an impact on our results too. Getting together with a chiropractor or a craniosacral specialist. Also working with orthodontists and general dentists when we see that we need the help. We're really big into that. ENT, some children really do have issues that they need an ENT for. And we need to have that evaluated first because I can't train a child to breathe through their nose if they really truly can't. It really does. It takes a lot of healthcare professionals coming together to build the awareness of what's going on, but also to help treat the kids.
That's awesome. I love it. Thank you so much
Well,
for being here with us today and educating us, shedding light on what you're doing and how you're helping shape the lives of kids so that they're happier and healthier. Are there any last words of wisdom you'd like to leave our listeners with?
I would just say to anyone who's listening who has a small child, I know it's super adorable when they snore. And then, like you pointed out, Fabiola, maybe it's cute because they snore like your husband or maybe like yourself. It's not normal. Pay attention to those little things. It's sometimes just those little things that can cause you to look for help. And those situations should be helped. So that, and as a parent, never ignore your gut.
True. Yeah, I love that. Also, thank you so much, Dr. Leslie. And we hope to have you back as a guest speaker another time.
All right. Thank you. Thank you very much for having me, Fabiola. And thank you for everything you do.
Thank you so much. Bye now.
Bye.